Hello, my name is Alysia Hunt Williams Calloway. I'm a doctoral candidate in the Doctor of Education in Learning and Organizational Change EdD-LOC program in the Department of Curriculum and Instruction at Baylor University. Today we will explore my dissertation presentation in preparation for my defense. Sense of community as responsibility in the U.S. East Coast community engagement field with African American adult altruism born of suffering survivors, a case study. I express tremendous gratitude to my dissertation committee chair, Dr. Brenda K. Jones, my two additional committee members, Dr. Leanne Howell and Dr. Nicole Duplessis, our EDD LOC graduate program director, Dr. Marquita Foster, the remainder of the EDD faculty, staff, and students, and other audience members who may view this video. I address my presentation through the listed 10 sections in 15 minutes or less to aid audience understanding of the research. The problem is that adult African American ABS identifying survivors face marginalization in the community engagement workplace based on multiple societal biases. Crenshaw 1991, Waller et al. 2022, which threatens their contribution to their field. Nolan Boyd 2014. ABS is the key term in this problem statement. ABS, or altruism born of suffering, is a positive outcome noted by pioneering U.S. scholars Staub and Volhart 2008 and Volhart 2009, in which some trauma survivors become more compassionate and civically engaged than other individuals in society. ABS is not a diagnosis. Some examples of how ABS is shown include activism, as reported by international scholar Taylor 2016, aiding across the sociocultural divide, as noted by international scholars Taylor and Hanna 2018, and volunteering, as reported by U.S. researchers Fraser et al. 2013. Furthermore, as suggested by U.S. literature such as Marty 2021 and Riley et al. 2021, ABS may be present in a range of ages in African American trauma survivors. The exact number of people demonstrating ABS is currently unknown. However, 80% of persons in the global study of approximately 20 countries reported trauma exposure. Benjay et al. 2016. Moreover, international scholars Dunlap et al. 2015, Guetta et al. 2021, and Roner et al. 2022 indicate effective community engagement by trauma survivors. Yet, marginalization occurs. This marginalization includes discrimination against survivors, Fukushima et al. 2020, Marty 2021, and workplace bias against older persons and African Americans, Fekadulin et al. 2019. Further marginalization may happen if bias is not addressed, Fukushima et al. 2020, Marty 2021. Understanding bias about adult African American ABS identifying survivors is key to wisdom on their community engagement. I reviewed the literature in three overarching parts, which relate to the problem that I focus on through this study. First, I began with a discussion of trauma and trauma survivors. Second, I proceeded to considering an understanding of community engagement. Third, I discussed biased beliefs in society regarding trauma survivors. I included international and U.S. scholarship in this literature review. Furthermore, I structured the three main literature review sections with a total of 8 relevant subheadings. On this slide, please see the listing of subheadings which connected with the statement of the problem. The purpose of this qualitative case study was to explore how African American adults who self identify with the positive trauma outcome, altruism born of suffering, ABS, perceive a sense of community as responsibility in their work in the U.S. East Coast community engagement field. One research question directed the study. I asked, how do adult African American ABS identifying staff in the U.S. East Coast community engagement field perceive sense of community as responsibility in their work experiences? I used sense of community as responsibility, SOCR, Boyd and Noel 2017, Noel and Boyd 2010-2014, as the theoretical framework to inform the research question. On this slide, I give my adaptive visual of the Boyd and Noel 2017 and Noel and Boyd 2010-2014 Sense of Community as Responsibility Theoretical Framework. Boyd and Noel 2017 and Noel and Boyd 2010-2014 are seminal authors of Sense of Community as Responsibility, abbreviated as SOCR. These SOCR seminal authors note three primary parts of the framework: a person's context, belief system, and their community engagement. First, context includes how a person's setting or a group of persons related to that setting indicates the suitable way to interact with that person. Nolan Boyd 2010 2014. Nolan Boyd 2010 note that context shapes a person's life experiences and societal establishments, guiding actions of that person, which produces their belief system. Belief system is the second part of SOCR. Norms, beliefs, values, and ideology or standards of conduct, as stated by Nolan Boyd 2010, page 836, and Nolan Boyd 2014, structure a person's belief system. Third, Nolan Boyd 2017 suggests a person's belief system and context couple to shape their SOCR for their choice to interact in a community, otherwise known as community engagement, which may be an organizational setting. These authors note psychological well being may be an indirect gain from community engagement, but is not necessarily the main reason for this community engagement. I stated my positionality in the study report as suggested by research standards, Mertens 2020 Yen 2018. For example, I acknowledged my similarity in background traits pertaining to the study sample. Also, I stated my constructivist worldview, valuing objective inquiry and no preset hypothesis or pre-chosen stance on the study, blending participants' various valid perceptions, which was based on Cresswell and Poff 2018, Mertens 2020, and Yen 2018. I decided to use a qualitative embedded single case study design. This research type emphasizes the dynamic realities of the case study participants. Cresswell and Poff 2018, Mertens 2020, and Yen 2018. Also, this research type highlights participants' real life state of being, Mertens 2020, Yen 2018. Additionally, Mertens 2020 and Yen 2018 advise that case studies allow for asking how questions. This guidance aided my use of how in the research question to explore participants' perceptions of SOCR and their work experiences. I protected individuals' informed consent, voluntary participation, and confidentiality throughout the study. Cresswell and Poff 2018. I used purposive criterion convenience and opportunistic sampling. Cresswell and Poff 2018. I used participants' personal contact information and the digital study flyer to help make prospective participants aware of the study. I listed the eligibility criteria and definition of ABS on the study flyer. Also, I yielded 4 participants in one urban Pennsylvania city in study recruitment. Each of these 4 eligible participants worked for a different community engagement organization in this one urban Pennsylvania city. Participants ranged in age from 50 to 69. The sample included 1 male and 3 females. All participants self identified as African Americans who show ABS. I triangulated 3 data collection sources aligned with the SOCR theoretical framework. First, I administered a qualitative questionnaire for each participant through Qualtrics. Second, I facilitated a one on one semi structured interview via Zoom with each participant. Third, I used Qualtrics to administer a reflective journal for each participant. Informed by the SOCR framework, I analyzed the data. I analyzed the data via a priori and in vivo coding with a priori categories and subsequent themes. I conducted thematic analysis based on Noel et al. 2017. From the study data, I yielded 5 themes, which I summarized in the visual on this slide. These findings aligned with the Boyd and Noel 2017, Noel and Boyd 2010-2014 SOCR theoretical framework to answer the research question. Themes 1 and 2 related to the SOCR component personal beliefs. Theme 3 connected to the SOCR component context. Themes 4 and 5 related to the SOCR component community engagement. Theme 1. All participants perceived power and control in leadership styles and emphasized needs in their work. Theme 2. Participants perceived it was normal to have ABS identifying survivors present in their work experiences. Theme 3. Most participants perceived oppression regarding resources or others in their work experiences. Theme 4. Participants perceived being change makers in leadership roles in their work. Theme 5. Participants perceived experiences of supportive interactions enriching their work. All themes connected with international and U.S. literature from the Literature Review. For example, in Theme 1, the data suggested ABS identifying survivors in the study sample control their post trauma identity through their leadership. This finding links with an international study by Van de Ven 2020 of a peer support group. Some survivors in that international study noted perceiving control in new ways of being after trauma. Theme 1 also connects with U.S. literature. For example, the male participant perceived his power differential with the white members of the board at the community organization where he worked, which preceded his decreased involvement in the organization. This finding may connect with Riley et al. 2021 and their study of undergraduate males who showed ABS. In Riley et al. 2021, some Black male participants reduced their community activities when they believed racism affected them. The findings of the current study suggest vital audiences which may help affect positive change relevant to the study sample. Based on the findings, I identified four critical target audiences for the study. The four target audiences include nonprofit community organization boards, adult African American ABS identifying staff and community organizations, laypersons with their respective policymakers, and researchers. These four critical audiences can help affect positive change for the six implications of the study relevant to the sample to enhance survivor staff organizational practices in community organizations. Connected with the findings, I note six implications as relevant to the sample. For example, regarding implication 6, I indicate that there may be a need to address unwarranted financial and relational barriers for these adult African American ABS identifying staff in their already challenging community work. This implication relates to the context finding about oppression and community engagement finding regarding supportive interactions. An example of recommendations based on the findings and implications includes collaborating with laypersons with their respective policymakers for improved funding opportunities, ABS awareness, and political access relevant to the sample. Based on the study, I identified two types of venues for findings distribution to target audiences for enhancing survivor staff organizational practices. One venue type includes two local churches to reach nonprofit community board members, adult African American ABS identifying staff of community engagement organizations, and laypersons with respective policymakers. Through my professional presentations at these churches, I may reach members of these audiences difficult to access through their work organizations. Also, I noted by making a presentation at the upcoming Baylor University Emerging Scholar Research Conference as the second venue, in order to expand inquiry on the study topic to enhance survivor staff organizational practices relevant to the sample. Here I offer the selected references. I greatly appreciate your listening to and consideration of this presentation.